I'm Ganna Dovbakh from Eurasian Harm Reduction Association, uniting activists and harm reduction organizations from 28 countries of Eastern Europe and Central Asia. 10 years ago, we believed our region was moving forward, building harm reduction services and protecting people's rights. But today, the reality is much darker. We see more arrests, more repressions, and the war on people who use drugs spreading across Europe. In Ukraine, Russian aggression has hit people who use drugs especially hard. When Crimea was occupied in 2014, opioid agonist treatment was cut off. 100 died. Since 2022, the war has displaced millions more, and across the region, governments are copying Russian repression in the drug policy, banning harm reduction services, and shrinking civic space to zero. And yet, activists and harm reduction organizations haven't given up. We are evacuating people from war zones, supporting refugees, continuing delivering healthcare in the toughest conditions. This resilience, our team gives me hope. But we need international solidarity. So here are my key asks. First, make sure NGOs working with people who use drugs have stable funding, especially when governments try to shut them down. Second, integrate harm reduction into general health and mental health services so no one is left behind. And third, protect and support people with lived experience. They must be at the table leading advocacy and bringing real needs to decision makers. Harm reduction saves lives. With your support, we can keep going it, even in the hardest times.